What does a typical day look like in a clinical setting?
Oh my goodness. So, a clinical dosimetrist in and of itself designs radiation treatment plans for the field of radiation oncology. So, we work with the radiation therapists to ascertain three-dimensional images of the patient that's going to be treated. Then we'll work with the physician who will draw out the tumor volumes and designate a prescription. And then from there, we use software to contour out what we call organs at risk. So healthy tissue that we don't want to treat. So, for instance, say we are treating a patient with breast cancer. The doctor will designate the area that we want to treat, and it's our job to make sure that we identify all the areas we don't want to treat. So, for a breast case, we want to make sure that we are identifying the lung, the heart, maybe the thyroid, and then we actually will plan a treatment plan that will maximize the dose to that tumor volume and minimize the dose to the other healthy areas of the body. Um, so we work with radiation therapists, we work with the physicians, we work with the physicists. We don't really work too much with the patients as much, other than getting the images, and maybe we're asked sometimes to help out during the simulation process. The simulation is where we're actually getting those three-dimensional images. There are times, sometimes in the clinic, that the doctor will ask us to come in and maybe meet with a patient and talk to the patient about what we were planning and why. There are times where we are going to chart rounds, and this is in a time where we're all speaking. The doctors are reviewing the cases, and we are discussing the cases, and talking about the different plans that we're doing, what we did, and why. So it's a really great educational environment. You're working, yes, as an individual doing the plans, but there's a lot of people that are involved in the process. And so there's a lot of brainstorming, there's a lot of collaboration that's being done for anyone that's working in the clinic.
So this is where actually one's experience as a radiation therapist helps because they get to see both sides of the coin. They are able to interact with the patient. If they had already been a radiation therapist, they would have definitely come in contact with the patient, see what's happening at the other end, and when they transition into dosimetrist, they understand the whole picture. Can this be a plus that way?
Yes and no. So definitely, when you have someone who's a radiation therapist and they're coming into the field, it's not new. They already know what a medical dosimetrist is. They know what a physicist is, and they to a certain extent have an understanding of what it is that we do. But they're looking at it from the perspective of treatment. So they have been taught in their own programs to be able to read a treatment plan, because they're actually doing checks to make sure that they have everything set up for when they treat the patient, right? So they do have a little bit of a leg up in that they already understand workflows, they understand the key players, and what we're actually doing in the clinic. But it doesn't mean that they know how to plan. So they're in the field because they're doing treatment, and now they're learning a whole new skill set. So I think there's really pros and cons for both RTTs and non-RTTs. It's hard work, regardless of what your background is. It takes a lot of dedication and hard work.